Growing up with type 1 diabetes, I definitely felt a lot of shame. Every time I would go to a doctor appointment, I would be made to feel like I wasn't doing a good enough job and that my care for myself wasn't good enough. So it was a bit of an isolating experience. Honestly, all aspects of life are affected by type 1 diabetes, and it can be quite mentally taxing.
When someone is diagnosed with diabetes, there's a higher risk of heart attack, stroke, infection, amputation, kidney failure, blindness. So the importance of regulating their blood sugar is to reduce those long-term complications of diabetes. I really can empathize with them how difficult it is to live with diabetes, manage diabetes day in and day out, all while just trying to live that normal life as well.
I was working at the diabetic foot ulcer clinic, and one of the problems we saw was their care was very fractured. So they would have to go see their diabetes specialist. If they were going to go on an insulin pump, be referred to a dedicated pump clinic. If they needed mental health support, yet another clinic. If they needed preventative foot care, they would go see a podiatrist. And so patients and their caregivers had to go all over town to get all these things. The wait list was extremely long for patients. It was up to a year, and you can't really live with a foot ulcer for a year. The risks of complications like infections, amputations, or death is very, very high. So we brought together all those services to make life easier for patients with diabetes and to improve the quality of the care that we're able to deliver.
The way the Edmonton Diabetes and High Risk Foot Clinic does things differently is they really prioritize patient experience. They've curated and built a great team to meet all the patients' needs, and everyone that works here is really passionate about diabetes care. It's very common for people to come see their specialist and get their foot care done on the same day. If I see a patient that wants to go on an insulin pump, but they might need a little more education and support in terms of carbohydrate counting, then I can introduce them to the dietitian while they're here and they can build that rapport and connection. So having everything in one location makes it a lot smoother, less wait times, and less chance of people falling through the cracks.
When I came to this clinic, it was a complete 180, making me feel I was an actual person outside of just numbers on a spreadsheet with my type 1 diabetes. And I think that ultimately made the biggest difference. Because it's very tough when your care team isn't really giving you the care that you need all around.
Everybody is an individual, so we really try to tailor our diabetes education plans and our nutrition plans to that patient specifically, so no one size is going to fit all.
Just a safer option to get the nails shorter. When patients come in, it's not always different doctors, different nurses. It's the same set of nurses, same set of doctors. They know us. Kind of a safe place where they feel comfortable and they can come to, where they know that they're receiving the care that they need. Overall, nails look really healthy.
I definitely would have benefited from being encouraged more and supported, and would have been way more motivated to care for myself if someone else was giving me the tools that I actually needed. Here, they are giving me those tools. They have made my life significantly easier in multiple aspects, and I really, really hope that every type 1 diabetic could get a chance to go to a clinic like this.
This is really an excellent example of a patient having one location for everything in one stop, and it really does improve the patient experience. So I do think that it's something that could be replicated, and I would like to see more clinics like this just to improve access for more patients.
If I had one thing to say to the clinic team, it would just be thank you for showing me that compassionate care and making me feel very seen and heard and valued as someone other than someone just with type 1 diabetes.